Fiona from Pelvic Floor Exercise, and today I am at home with Assistant Professor Craig Allingham. We decided that in honour of Men's Health Week this week that we would sit down and have a little chat. Craig and I are able to do that because we actually live in adjoining suburbs here on the Sunshine Coast, and we are suitably socially distanced as we have our chat. So Craig, let's just start off with how did you transition from being such a well-known sports physio to being a men's health physio who's written 2 books?
Well, thank you for that question, Fiona, and thanks for dropping by here at Allingham Central. So it's an easy one to answer. I'd done a lot of sports physio, as you say. I'd run courses at university and the master's programs and lectured around the world and done Olympic Games as team physios, etc. and loved it. But in the late 90s, my dad got crook with prostate cancer. And all the skills and all the experience and all the expertise I'd developed in those years proved to be of very little value to him. The one person in the world I really wanted to be able to, look, you've invested in me, you've raised me, time to repay. No, I had nothing. There wasn't a lot to know, but even that I didn't know. So I finished my sports commitments after the Sydney Olympics and thought, what am I going to do with the rest of this career? I'm not ready to put down the tools yet. So I researched a bit more on men's health, particularly with a view to prostate cancer, and realised this is about muscle training. This is about rehab. This is about recovery from illness. I can work with this. I've got the skills, basic skills, I just haven't learned how to apply them to a new condition. So I started to develop a practice on that, working with local urologists and found out that what we do know as basic musculoskeletal physios, sports physios, we can turn them to other muscles.
Thanks for sharing that really personal story with us, and it is interesting to see the transition, because I know as women's health physios we often get into the field after we've had babies and perhaps had issues, so it's interesting to hear how you would transition into men's health, especially having had that experience. We actually worked together as Prostate Cancer Foundation ambassadors back in the day, which is probably when we first worked together, probably 10 years ago maybe.
Around that,
We used to do talks, educational talks in the community. So Craig, have you seen any changes in the education side of things since then on prostate cancer? Are men more aware now?
Oh yes, men are more aware, more men are aware. A lot's changed in prostate cancer, everything from diagnostics, technology, the science of treatment. There's a lot more treatment available for prostate cancer, which doesn't help the poor blokes because that's just makes the decision even more difficult. But in terms of education and understanding, yes, the peak bodies, the Prostate Cancer Federation you mentioned, Movember, we now have a Men's Health Week, which we're in. I thought initially it was Men's Health Week spelled W-E-A-K because that's what Men's Health was, pretty weak. But I think it's evolving to something a bit more positive. And we have Prostate Cancer Month of September. So yes, the community awareness programs are working, and of course there's more men, this is the sad part, there are more men getting prostate cancer. So more families who are aware of prostate cancer. The incidence has increased because it's predominantly a disease of older men. And the baby bubble, or the bubble of baby boomers is moving through the population. And these are the same guys we used to look at for sports injuries back in the 80s are now prostate cancer candidates in the 20s. So the medical services and interests and shifts with demand, and the demand is shifted towards prostate cancer because the rates of incidence and detection are so much higher.
And it's not just older men, is it? Some younger men can be diagnosed?
Well, exactly. I just mentioned detection, and the detective strategies of identifying prostate cancer have become so much more sensitive that they're picking up lower grades of prostate cancer that wouldn't have been picked up 20 or 30 years ago. And so men, when they're tested have a grade 1 or a low grade, low volume, low aggression prostate cancer, are being identified as having prostate cancer, and that immediately sets off the family alarm bells about dad's got prostate cancer, I've got prostate cancer, we're all going to get prostate cancer. And the word cancer still strikes fear into that generation.
Absolutely.
And says, got to have it out, cut it out, kill it, burn it, nuke it, whatever's required I need to get rid of this prostate cancer because I've only ever heard bad things about it. And that's true. So younger men are being diagnosed, one, because they're more aware of it and aware perhaps of their family history of it, and so they're saying to their GPs, give me a PSA test, get me tested for my prostate risk factors. And then they're being identified at a lower level, and so they are now being lumped together as prostate cancer data. Whether they need treatment or not is a whole different discussion.
So, do you think that men can do more as far as prevention goes? Are we looking more now at helping these men prevent developing it, rather than waiting until they're diagnosed and it's the end of the world? And
yeah, prostate cancer, we're talking men's health. Men's health is a big box. You know, men die of prostate cancer, men die from prostate cancer, or the secondary cancers that are seeded by a prostate cancer. Your prostate cancer won't kill you on its own. If it stays in the prostate, you'll live quite happily and die of something else down the track. Because your prostate gland is not a vital organ. You can live with a diseased or even an absent one. So for men, it's once you've progenated, once you've fertilized enough eggs to suit yourself, you really don't need your prostate gland anymore in terms of how your life will function. So it on its own is not, but when it spreads, when it metastasizes and starts to cause other health issues, then obviously that can be quite nasty. So what was the question? The prostate cancer, prostate cancer is the end game of poor health maintenance. It's a cruel way to look at it. So look, a guy comes in with prostate cancer, will say, well, it's your fault, you didn't look after yourself. Well, that's a bit harsh, but there is a genetic component, male primary relatives, uncles, fathers, brothers have had prostate cancer, or one of my clients, a son, was first diagnosed and then his dad got tested and he turned out to have it as well. So there is a strong genetic predisposition, but that's no guarantee. That's no guarantee you will develop a prostate cancer, just that your prostate or your internal environment is a bit more likely for that to happen. But there are so many environmental factors that can impact on the expression of the gene that triggers your prostate cancer. So you can have the gene, but if it never switches on, your prostate cancer doesn't trigger. And there are environmental factors that will determine the likelihood of a gene, a prostate cancer gene in this circumstance, turning on or not turning on, the switch. And that includes what you eat or drink, how much, what it is, what you do, physical activity levels or don't do, stress levels, basically all the things that will impact on the health of your immune system. Your immune system is your frontline defender against the first rogue cancer cell.
So a lot of lifestyle changes. Are there a lot of things that we can...
things that are within our influence.
That we can. And is that what led you to write your second book?
Yes, definitely. The second book, yes.
Which I'll show
you.
The
Prostate Playbook. I was sitting in a huge auditorium in Boston at the American Urological Association conference. We're talking 30,000 delegates.
Wow.
Delegates, okay. And so big event. And I chose, because you can't go to everything, it's over a week and you choose the stream. So I went to a lot of stuff that was on prostate cancer and diagnosis, yes, treatment, incontinence, not much on that because these are urologists and none of their patients become incontinent apparently. But the bit that was interesting was this new concept of active surveillance. It was fairly recent and it's being written up in the press and everything. Active surveillance evolved from watchful waiting, which we used to call it, which sounds a bit passive. Active surveillance sounds a bit more dynamic and probably better reflects what they're doing. The idea being for these men that we mentioned before with low volume, low aggressive prostate cancers who may well be young, but not just young, just active and want to stay active and particularly sexually active, then maybe their prostate cancer does not demand immediate curative treatment in terms of surgery or radiotherapy, or it's not called radiotherapy anymore, it's called radiation therapy. So so that they talked about this active surveillance. So they would be diagnosed and then they would choose not to do the treatments and they would monitor the PSA and the digital rectal examination and MRIs over the next years to see if it changes to the point where it needs treatment. Well, they were really good on the surveillance. really good on all the tests they could do. I mentioned 3 of them, but there's others as well, and there's the PSI, the prostate, the PHI, the prostate health index, and there's this and there's that. So there's all sorts of ways of permutating the data to give a score that says you're more at risk, you need to go into treatment now. But none of these incredibly intelligent and educated and clinically focused men and women ever mentioned the active bit, only the surveillance. And I'm sitting in the audience thinking, well, I come from active background. I'm all about exercise, rehab. What can men do for the active bit, not just the surveillance every 6 months? And so coming back from that conference, I hit the literature, hit the library as you do. And the great idea of hitting the library now is you don't need to leave home.
Yes.
You can do it all online. So I went into the library and pulled out all this huge amount of peer-reviewed quality research information on lifestyle factors that can help switch off or not activate or protect or sabotage the switching on of a prostate cancer gene. What you eat, what you do, how you think, stress levels, immune system, all of that. And I thought, men need to know this. And they're not going to do the same research I did because they don't have that skill set. So it turned up in the book. Yes, so just a simple book that covers everything they need to, sleep patterns, immune system function, how a cancer develops and what you can do to interrupt the process, and vitamins, supplements, and importantly physical activity, and what involved in that. Not just going for a leisurely walk around the neighbourhood, but actually doing proper physical activity that trains your body.
Which is good for overall health anyway. Yeah.
That's it. I don't make the point in it, well, I'd probably do in the epilogue, but if they do these programs for their prostate cancer, it also reduces the risk of bowel cancer, cardiovascular disease, diabetes, obesity related conditions, yes, all
and
sorts of things.
that can be a bit of a vicious circle because a lot of those conditions can lead to
They all have these comorbidities because they're older dudes. It's nothing new, it's just repackaged, and because it's about the prostate, and the doctor said you've got a prostate problem, they're more likely to read it. Yeah, they're more likely to engage with it and say, okay, this is about me now. Because men are very good at thinking health risks are risks for other men. Yes,
because that was one of my next questions. A lot of men don't realise that they have a prostate until they're actually diagnosed. And it's also, how do you find men approach their health issues? Because Men's Health Week has mainly focused a lot on prostate cancer, prostatectomy, which is a surgery for prostate cancer, and the recovery afterwards. But do you see it as encompassing other health issues for men? Should we be focusing on some of the other things
absolutely.
as well?
Yeah, that's it. And this concept of men's health as being everything behind the nail bag, it's more than that.
Yeah.
As I said, prostate cancer, erectile dysfunction, most of it, urological conditions, are often the end game of things that he could have done better earlier in his life. And I'm talking from teenage years. So it's a long game that gets played out. Same with your cardiovascular disease. The narrowing of the arteries doesn't happen in the week before you have the test. That's been happening for 30 years before your doc says, go and get your testing done. The men think in my experience, men think they're healthy. First of all, if they can get out of bed in the morning, get their pants on the right way around, I'm healthy, I'm good to go. And they can get to work and get through a day's work and a day's play and a day's fun and meet up with their mates or go and play with their family or their grandchildren. They think they're healthy until somebody proves they're not. Right. And they confuse very much healthy with fit. So if I'm fit, I can play football, I can play lawn bowls, I can walk around the block, I can do this, I can do that. There's nothing wrong with me, I'm good. And you're a clinician, you know that when you ask a man how, in the course of your first interview and they come in for whatever condition, how's your general health? He inevitably says, great. Yeah. Great. And then the next visit, he'll tell you about the stent he had put into his heart 2 years ago. And the visit after that, he'll tell you about his dad's diabetes and how his sugar levels are being monitored. So eventually he will share health information with you, but not when you ask him, how's your general health? Oh, it's like great.
Pulling teeth.
If you ask him, how's your knee? Well, I told you it's sore, I've injured it, but how's your general health? Great. And why are you asking? What's that got to do with my knee? And as a physio clinician, and this happens to the GPs as well, a bloke comes in with a crook knee, he thinks that's all we're interested in. His knee, not his health. And the biggest epiphany I had was realising that every male that came in for treatment was a men's health consultation. Nothing to do with his prostate, nothing to do with incontinence or erectile dysfunction, nothing to do with what's behind the nail bag, but everything to do with his health behaviours, his health attitudes, and his health education. So as soon as I could find the safe place in the consultation to ask the questions, when did you have your last checkup with your GP? I'm just interested, you know, you look a bit overweight, have you ever had that monitored? You know, tell me about your playing days at sport. First of all, always ask them what they were good at. And what they excelled in their younger days, and then what was your playing weight? Well, that's a great question. What was your play? Oh, you know, I was 82 kilos. So, oh, right. Probably not 82 kilos now, are you? No, I'm 104. So, oh, would you like to get back to your playing weight? No judgment. Would you like to? So, not, geez, you put on a lard-ass porky, haven't you? So, no. So, just ask him, would you like to get back towards your playing weight? So, start to introduce the conversation towards health information, health education, while I'm treating his injured knee from whatever he did in the garden. So once I got that idea of getting that safe space of chatting about it, we're good to go. And it helped that we're sitting in a clinic surrounded by the Olympic memorabilia. It was a blokey space.
Good environment to get them to open up.
There's a practice, a urological practice in the States that's taken it to the nth degree. That they call themselves man cave, and it looks like, you know, sort of a sports club for men. But it's a medical practice. But great. Everything from the waiting room to the treatment rooms, it's all just man cave. You know, there's cars and there's, you know, sports memorabilia everywhere, and the lighting's different. Everything is just, this is a safe space for
genius.
men. And so all those things you have to think about to get the engagement to work, because otherwise men will just tell you what they think you need to know instead of really what you need to know.
Is it a bit of head in the sand sort of section? I've seen you do your colander on the head trick.
What Fiona's referring to there is the variable speed ego filter that all men have. And as a clinician, sometimes you've got to drag them kicking and screaming from the first visit to actually getting them to follow a program, to comply with whatever it is, whether it's musculoskeletal, sports rehab, or in this case, a continence retraining program. And they will put up barriers for you at every opportunity, because anything you tell them that makes them feel uncomfortable, their filter in their mind, the holes close over a little bit to protect their ego from being ignorant and being, you know, obviously having done the wrong thing, and knowing deep down they've probably not been living life as they should, but I don't want you to tell me about it. I'll sort that out myself somewhere else. Thank you very much. Get back to my knee. So this filter closes up, and my job as a clinician was to keep the holes as open as possible, so that everything I said after that still got through and stuck somewhere in this bloke's mind. So I had a chance of him staying with me to get onto the program and investing his energy and expertise into fixing himself. It makes no difference to me. I'm not going to get sick if he's sick. So it's always about them and information presented in their best interest. But the male variable speed ego filter is a real trickster. It can make the best clinician, you know, grind your teeth and say, why doesn't this bloke just get it?
I think most females with a male partner would say the same thing about most issues.
And we could go through the history of manhood and manliness and come up with evolutionary reasons why this might be the case. But still, it's in their DNA somewhere that looking after yourself is not the highest priority in life. Providing for your family, that's a high priority. Being seen as strong and powerful in your peer group is a high priority. Lots of things, but looking after your health, and particularly you see this in young men, in teenage transitioning to man, it's almost like they're thinking, well, what could I possibly do to destroy myself between now and when I'm 30? With drinking, driving, drugs, risk-taking behaviours, choosing bad friends, who knows what it is. But, and this is not the only I'm not talking just the generation now, generations before. It's just what young men transitioning to manhood think needs to be done, or are imprinted with what needs to be done, not even at a decision level. So that can sow the seeds of poor health behaviours from then on.
So hopefully the message is coming across through Men's Health Week, and also in mental health as well
Exactly.
is a huge issue. So
Mental health is
of all ages.
disastrous. We lose so many young men to suicide and self-harm behaviour and self-destructive behaviours. It may not be an active suicide, but following self-destructive behaviours, funnily enough, destroys self. They have their car accidents and they got 3 mates in the back, and you only have to look at the news feeds to see that young men do silly things at times. Not all of them, never all of them, but there are certainly plenty. But the highest level of suicide in Australia for males is older men, over the age of 65 to 70, who are lonely, who have lost purpose, who no longer have a career, who are unnecessary to raise a family and a grand family. So they just get a bit lost. And that's why I enjoy the work I do with the local men's shed, which is these blokes who would otherwise be sitting at home or in their own shed at home by themselves, not really engaging with peers and not really having their expertise utilised from whatever occupation or hobbies they've had through the years. But put them in a shed together and they are awesomely productive and just build stuff and have fun and talk rubbish to each other, and just like they did for the rest of their lives. And that saves lives, and we know that from the data we collect in our shed.
And that's often where those health messages can come through in a local environment.
Age, gender specific health messages. And it's delivered by someone else who's got white hair, that sticks a bit more as well. So I have a lot more empathy for older patients. Well, now I've become one. Well, thank you for sharing all of that with us, and hopefully the messages coming out from Men's Health Week now are encompassing more than just the recovery from prostate cancer. I think so. I think prostate cancer is really important, don't get me wrong, and that's why I've written the 2 books, the one on the sabotage strategies to prevent, and also the recovery strategies if you've had treatment and need to work on your incontinence. And this is not just my work, this is the work of many. I've had the great joy of working with colleagues from Dr. Joe Milios in Perth and Stuart Baptist in Sydney, Peter Dornan in Brisbane, Maria and Debbie Dillon over in the UK, and Adam Gilvey in New York. So lots of physios are turning to men's health as a really satisfying component of their clinical work. And it's been a real, probably what's given me most fun is I was there early on. Peter Dornan was the only bloke before me that I was aware of, and he got it kicked off, and he came from high level sports as well.
That's right.
And then have been able to grow and train and work with these colleagues, and then have people coming and doing our workshops. So I feel like I've been able to contribute not only to what I couldn't do for my dad, but for a lot of people's dads are now going to benefit from physiotherapists in Australia and around the world learning more about men's health, and particularly the prostate cancer aspect of men's health.
And it's great that we can apply our clinical reasoning skills that we used back in our sports days and our early days as physios to the men's and women's health issues that we now treat.
Oh, exactly. The best fun I ever had was after the first book, and I was already running courses on my own, and then with Joe and Peter and Stuart around Australia, the Mastering the Martians events. Paul Hodges came to one, and he said he sat through the course and he took a lot of notes, and it was very good. Didn't ask any difficult questions, Dr. Hodges. And then at the end he said, "You're on the right track." Because what we're finding in the research with him, Ryan Stafford's work at the University of Queensland, all the cues you're using, all the exercise strategies you're using, they match up with our research findings.
It's fabulous,
and I thought, clinical experience is still worth something here. Good, just listen to your patients, question yourself, try different things, find out what works, and throw away the rubbish, and eventually you'll get a good system. It's not perfect, but for most men, they will get some improvement on these programs. And
I think the great things about your books, because I had the pleasure of helping to edit, I'm very honoured, having a read through before, is that they're in plain language that blokes can understand and relate to, which should make it easier for them to put into practice.
You know what? Gets through their filter.
Yeah, there you go.
It's written to get through the filter.
Yep.
Yeah, there's no point me using long words and sophisticated medical concepts and talking down to them.
Well, that's
because
what
the
we
filter
find,
just
isn't it?
closes up.
Yeah, when
and
you talk
they
to patients.
They won't read that.
Yeah, yeah.
But if there's some jokes, if there's a bit of humour and some, some pictures along the way to break it up, and not too many words. I mean, the longest of them is an 80-page book. Seriously, men are not going to read 300 pages on men's health. It's just not going to happen. They might choose the chapter on their interest, but so this one at least we've got a chance of them getting through the whole thing and working out that it's worth doing.
Well, thank you very much.
Fiona, it's been an absolute delight. Thanks for
what
dropping by.
I would like to finish with though,
Oh.
just so we get to know the man behind the books a little bit. I'm a huge fan of the show Would I Lie to You, and I know, having known you for many years, that you wouldn't lie to me.
Oh.
So how about you tell us something about yourself that perhaps other people might not know or might not believe?
Either, yes. All right. My great skill that most people don't know about, and many don't want to, is I am a dab hand with the piano accordion.
Really?
If
I'd known that, I would have asked you to play.
Thank goodness it's at the end. Yes, and this is another thing I caught from my family, because my grandfather, Reuben, my dad's dad, played the piano accordion.
Wow.
And I, the clearest memory in my history of him, because he died quite young of heart disease, was him playing the piano accordion at his place, singing a bit and just making this cacophony of noise out of this squeeze box. And I thought, oh, how good's this? Just because it was him. But then my parents decided, okay, this is a family tradition, you seem to enjoy it. So when I turned 8, they gave me a piano accordion for my birthday and signed me up for lessons, and ever since then, yes.
I now have an image in my head of Craig in Lederhosen playing his accordion.
I have done that. I have done that in Germany. Exactly right, yes. They never asked me back there.
Well, thank you so much for chatting with me today, Craig. And hopefully, if this has encouraged any guys out there to perhaps go and have a checkup for any part of their men's health, then it'll be worth it. Apart from the fact that we've had a bit of a fun chat.
A checkup is the best thing to do. If you think you have any health issues, prostate or otherwise, don't keep it to yourself. Share it with your doctor, and they will guide you, help you navigate through the diagnostic and treatment options.
Thank you very much.
Thank you.